Hello, my name is Natasha, and today we're going to be discussing prayer as a complementary therapy. Prayer has been classified by alternative medicine researchers and policymakers as a mind body intervention, making it a complementary and alternative medicine. According to the Merriam Webster Dictionary, praying is defined as a religious act or practice of praying to God or an object of worship. Many people in different religious traditions across the world practice prayer for health as a way of healing. According to the 2017 Australian Community Survey, 3 in 10 Australians have active spiritual lives, pray, or meditate at least once a week, despite the erosion of religious engagement in Australia. 6 in 10 believe there's a God or some sort of spirit or life force. 43% of Australians pray every day, occasionally, or a couple times a week. A news article by the Sydney Morning Herald discussed how researchers found that 47% of Australians started praying more during the COVID 19 crisis because of worries for their mortality. Despite the increase of prayers during crises such as COVID-19 or during bushfires, prayer is also used as a means of managing health related symptoms of chronic illnesses such as depression, anxiety, severe tiredness, cancer, or other major illnesses. Prayer has been shown to result in psychological and biological changes that are potentially associated with improved health outcomes. Praying regularly is believed to reduce stress, decrease the risk of stress related health problems, improve emotional regulation, or even decrease the risk of depression and anxiety. At this point of the video, we're going to listen to an interview on how Mark Kondowe used prayer as a complementary medicine. What complementary treatment did you use?
I used prayer.
Why did you choose to use this complementary treatment?
I wanted to heal my depression or to treat my depression without using a medicated approach because I was worried about the side effects associated with taking the antidepressants.
Are there other treatments you were using in conjunction with praying?
Yes, they are. So mostly I would join prayer groups where I would go for prayers on Mondays, Tuesdays, or sometimes I'd stay at church for the elders to pray for me.
Are there any risks you are aware of about this complementary treatment?
I wouldn't say a risk, but my worry was that it would take a bit longer for me to treat my depression, and also the chances that the method wouldn't work.
Was the complementary treatment helpful?
Yes, I would say it was helpful because the first session that I had, I did feel a lot of weight taken off my shoulders, and I did feel like a different person.
Thank you for doing this interview. Prayer can be useful in that some patients have a positive outcome of improved health. It helps patients to cope with difficult situations and put it into perspective. It also challenges healthcare professionals to demonstrate their commitment to patient centered care by addressing all parts of a patient's life. It is also a non medicated option. Disadvantages of using prayer is that if prayer is not part of a patient's spirituality, it might not be easily accepted as an alternative option. There is no guarantee that it will work every time. There is no definite time frame of how long it would take before it works. Not everyone is spiritual and would consider prayer, so it can be unfamiliar and uncomfortable. It can also create a role of confusion for healthcare professionals. Our position statement when it comes to prayer is that using prayer as an alternative treatment is promising and one that needs to be allowed in order for healthcare professionals to meet clients' individual needs. It helps widen a healthcare professional skills of intervention when addressing a patient's spirituality. It is also cost free, drug free, and helps patients put their illness into perspective, is a source of hope, helps decrease stress and stress related illnesses. Depending on severity of patient's illness, it is definitely an alternative treatment worth trying in conjunction with other treatments as there wouldn't be any drug interactions.